everyone, my name is Linda Solomon and I will be discussing the use of point-of-care ultrasound for the shoulder, specifically for the diagnosis and management of shoulder dislocation. In this talk, we will go over the following for POCUS in regards to shoulder dislocation: the indications, which probe to use, image acquisition, normal shoulder anatomy as seen on ultrasound images, pathology and abnormal findings, pearls and pitfalls, and an illustrative case. There are certain indications for using POCUS in a patient with a shoulder dislocation: to evaluate for and/or confirm that the shoulder is dislocated, to confirm reduction, and to potentially locate fractures to the humeral head. Ultrasound is also commonly used to guide the procedure of intra-articular injection of lidocaine for a regional shoulder block to obtain adequate pain control prior to reducing the shoulder. However, for this talk, we will stick to talking about the top 3 bullets. For this POCUS application, you can use the linear high-frequency probe or the curvilinear low-frequency probe. For a larger patient with more subcutaneous tissue, the curvilinear probe might be more useful as it provides better penetration and depth. The exam setting on the machine should be set to MSK or something similar. Using the appropriate probe, have the patient sitting up with the transducer placed posteriorly and horizontally along the patient's scapula as seen in this picture. The ultrasound machine should be in front of the patient so that both the patient and the screen are in your same viewpoint. With the probe marker pointed laterally, you should obtain this image on your ultrasound screen. Once you obtain this image, here is the anatomy you are seeing. The round structure labeled A is the humeral head in its normal anatomic location, in B, the glenoid fossa, and C is the body of the scapula. Here is a video clip of the same view. Again, you see the humeral head on the left side of the screen in the glenoid fossa, and also the body of the scapula. Here you see normal motion of the humeral head during external rotation. Now let's compare what an abnormal shoulder POCUS looks like. The image on the right of the screen is a dislocated humerus. The humeral head A can be seen anteriorly dislocated out of its normal position and away from B, the glenoid fossa. And again, here you see C, the body of the scapula. Some pearls when it comes to shoulder POCUS. If used appropriately and in the right clinical setting, we can avoid unnecessary radiation and significantly decrease length of stay. It can also reduce patient discomfort. One pitfall can be obtaining adequate images, especially if the patient is experiencing a significant amount of pain. So make sure adequate analgesia has been given to the patient prior to the exam. Also, in the setting of trauma, ensure that your physical exam does not reveal other areas of injury near the shoulder as well, including but not limited to the clavicle and chest wall before focusing on the shoulder with your POCUS exam. Let's move on to a case. We have a 17-year-old male with no significant past medical history presenting to the ED shortly after experiencing severe pain to his right shoulder after an assault. He states that he felt a popping sensation in his shoulder. He denies pain anywhere else and denies numbness or tingling distal to the injury. He has no history of shoulder issues and no prior surgeries and is not taking any medications. On physical examination, the patient's vital signs were unremarkable. The patient was noted to be awake and alert, but in moderate distress from pain. He had normal cardiac, pulmonary, and abdominal examinations. His MSK examination was significant for limited range of motion of the right shoulder due to pain and with notable squaring off of his right shoulder joint. There was pain on palpation of the shoulder joint, but no other bony tenderness was appreciated. There was no ecchymosis or swelling noted, and he was neurovascularly intact distal to his injury. Differential diagnoses in this patient included humeral head dislocation, fracture of the proximal humerus, and or fracture of the distal clavicle. When POCUS imaging was performed, we see this image on our screen. We see A, where the humeral head is located anteriorly, from B, the glenoid fossa, where it should be. The patient's ER course was as follows. The emergency physician performed point-of-care ultrasound, which demonstrated a right anterior shoulder dislocation. Using sterile technique, POCUS was next used to guide the injection of 1% lidocaine into the glenohumeral joint space in order to provide regional anesthesia. The patient's shoulder was then reduced using an external rotation technique. Point-of-care ultrasound confirmed that the shoulder was successfully reduced and also identified a Hill-Sachs deformity. Post-reduction radiographs were obtained and also demonstrated that the shoulder was relocated. The post-reduction X-ray showed a Hill-Sachs deformity, which you see by the arrow on the X-ray on the left and also noted by the arrow on the ultrasound image on the right. So in summary, and some key take-home points, use of POCUS can decrease length of stay and pain for the patient with a shoulder dislocation. Have patient in a comfortable position and with adequate pain control during the exam. And POCUS of the shoulder can be used to identify dislocation, successful reduction, and sometimes fractures. Thank you for listening, and if you have any questions regarding this lecture or the use of POCUS for shoulder dislocation, please feel free to contact me.